Hello and welcome. I am Munmun Bhattacharya and you are watching a special broadcast, COVID-19 Facts versus Myths, on the situation arising out of the prevailing coronavirus pandemic. Over the next 30 minutes, we will be taking questions from you so that you get accurate information for combating coronavirus outbreak. To answer your queries, I have with me in the studio two guests to bust myths about coronavirus and give you the facts so that you know what it takes to be safe without panicking and falling prey to the rumor mills. Our telephone lines are open. The numbers are right there on your screens. They are. Note them down. You can call us on 011-2309-7663, 011-2338-6682 and 011-2309-7620. I repeat the numbers, note them down. They are 011-2309-7663. The other number is 011-2338-6682. And the last one is 011-2309-7620. 011 is the code for New Delhi, and in case you happen to be living outside India, then please prefix +91 or dial 0091 to these numbers. So let's dispel the myths and put the facts right there before you. To do that, we have with us two guests in the studio. Dr. Prasar Chatterjee is Associate Professor with Department of Geriatric Medicine in AIIMS, and Dr. Desh Deepak, he is the Chief Medical Officer and also Senior Chest Physician with the RML Hospital. I welcome you both to this special broadcast. I'll begin with you, Desh Deepak ji. Prime Minister Narendra Modi appealed to citizens to self-impose a Janta curfew of sorts on Sunday for 14 hours, starting 7 a.m., ending 9 p.m. Do you think that this is going to be instrumental in breaking that vicious cycle of transmission that we've been seeing?
So, I think that's a very important question. Let's understand that this alone is not going to break the vicious cycle, but it is a measure akin, like we keep a fast for a day. So, it's a measure of disciplining ourselves, where we understand that, okay, if required, what we have to do, because this is the time when we have to distance ourselves from each other, and as we've been discussing, the distancing is the physical distancing. We can still be in contact with each other, but the whole motive this time is not to spread the infection from one person to another, and I think that is the idea why the Honorable Prime Minister has suggested, to be indoors or do this Janta curfew on Sunday.
Dr. Chatterjee, are the elderly in a vulnerable age group as far as contracting novel coronavirus is concerned? Because if you look at the 4 fatalities in India, then all of them are in the 60+ age group.
Yeah, it is absolutely right, because there is a immune system which protects us from various bacteria and viral infection and related complications. So with aging, there is a winning immune system, that is the protection system, which is going down, and there is a already underlying chronic inflammatory process due to various disease, and most of the elderly people will have some disease or others. So on top of that, when someone is getting one more infection, which is spreading very fast within the lung, which ultimately develops respiratory failure or acute respiratory distress syndrome, we call. So inflammations spread very fast in elderly. So that is one reason. And other complication of COVID-19 is, they can develop septicemia. That is also, they are more prone to develop septicemia. Further, as with aging, there are the other morbidity which are there, like lung problem, heart problem, kidney problem. They are all precipitating the complications related to the
So
viral
what
infection.
should the elderly do now? Prime Minister said that if you are above 60, stay at home in these trying times. What would you say?
Absolutely. I fully agree with that. And whatever previous study from China and other country, you can see highest mortality is 80+, and those who are 60+ with multimorbidity, they are also at equal risk. But I will also extend this age bracket maybe on 40-50s who have multiple disease, especially who has heart problem, cardiac issue, who has lung problem like COPD, bronchial asthma, and who has some form of kidney disease or any other immune suppressant disease like diabetes or retrovirus positive things. They should self quarantine themselves within the home, And for elderly people, I'll say again there is a discussion going on across the globe that what about their dignity, what about their autonomy if we distance them from other. It's a purely physical distance, not social distancing. You can still socialize through digital media, because that is the main media, main platform nowadays. Virtual media through we engage ourselves socially. So do that, introspect that, do yoga, do meditation, do exercise at home, take plenty of adequate amount of food, adequate amount of liquid, fruits, vegetables, which will boost your immune system. Do whatever you want to do, you do it within a house, because that is going to save not only you but also to spread the infection. Because two things: one is, don't allow the virus to go inside your body, inside your system, and prevent spread to others. So that is only possible through self-quarantining within home at least 2 weeks.
Absolutely. Let me remind our viewers that the 3 numbers that are flashing on your screens are the number on which you can call us. You can dispel any myths that you may have on novel coronavirus. You can get medical advice here from the 2 guests who are here with us in the studio, because what's extremely important to fight or combat novel coronavirus is to be aware and to follow preventive measures so as to prevent the further spread of novel coronavirus and keep yourself safe. Well, Dr. Deshdeepak, what are the symptoms that a patient who has contracted novel coronavirus would exhibit? Are these uniform symptoms, or are different people showing different symptoms? Are there people who are not showing any symptoms? Are they asymptomatic patients as well?
Yeah, I think that's a very important question to understand. See, 80% of the people will not need any treatment. They may need just mild symptomatic treatment. These people will have mild symptoms like headache, myalgias, which is body ache, sore throat, cold, blocked nose, these kind of general symptoms which everyone keeps on getting with the when one gets a flu. And 80% of the people, as we are reinforcing again and again, have been seen that they become all right without much ado. It is less than 20% of the people who would need hospital care, and in fact maybe less than around 6% would need a critical care. Those are the figures. But if you go into detail, countries like South Korea, who have used very good measures, in spite of having large numbers, their mortality is just around slightly more than 1%. So these measures that we are talking about the personal hygiene, coughing or sneezing into our elbow, washing hands properly and frequently, these are effective in preventing the spread and maybe in reducing the severity of the disease.
But when would a patient know when to go for a medical intervention at this point in time? Because you are telling us that different people are showing different symptoms.
Yeah.
What should they do? Because when they are going for testing, they are being told that if you have a travel history, then you would be tested, or if you've come in contact with someone who has a travel history, only then would you be tested.
Yeah, so it is important to understand that this virus, one will get affected only if one comes in contact with somebody who has this virus. So and right now, as we are seeing that all of the cases are imported, that means people, those who have been found to be positive, either they have traveled abroad or are close contacts of such people. So these people who are in close contact of people who have come from outside, or those people who are taking care of a confirmed COVID-19 patient, these are likely to suffer from this. And how would you know? So suppose you fall into these categories and you start developing symptoms like fever or sore throat, then you are likely to get then you should go and get yourself tested. Otherwise you are not supposed to go and get tested. But I would say, suppose one is having severe respiratory illness, then in that case he must approach his doctor or the facility who can take a decision whether he needs to be tested or not.
Now, I'll come to you, Dr. Prasoon Chatterjee, on the elderly, because you are into geriatrics. What if an elderly is showing symptoms of some other disease or has to go to a hospital or see a doctor for routine medical checkup? What should they do? Should they venture out of their homes in such a scenario?
No, like yesterday, Honorable Prime Minister mentioned that for chronic disease like hypertension, diabetes, you are coming routinely to get some medicine. So that should be avoided. Even elective surgeries should be avoided now, because anyway, whatever we say like contact history, travel history, it's very difficult in a crowd to understand who has contact and who doesn't have contact, who has traveled and who has not traveled. So it's better to have distance from the crowd. But when you are coming to any hospital, be it government or private or any clinic, there are high chance that you will have close contact with many people, and you never know any of them is suffering from the disease. So especially for senior citizen, elderly who are especially 80 plus, and one problem with elderly is they hardly develop fever the way others develop. One of the very common symptoms for this COVID-19 is high grade fever. Because of their thermoregulatory mechanism, they very hardly develop fever, but still they are suffering. They are carrying the disease. So once there is a symptom which is disproportionate to which you have suffered, many people suffers in every, and this is the season for flu. So you may be suffering from a normal flu. And one more point I want to mention here is why it is so dangerous than other flu. It's almost in same group of virus, but here it is highly contagious. In case of normal flu, they can, if you come in contact of normal flu, there is chance that one flu patient will affect 1 to 1.5 people. We call as reproduction time. So, but in case of COVID-19, it is going to affect 2 to 3%. So if I say one person who came from abroad, some affected area, who was positive and missed in airport, anytime you can miss that, and then not quarantine, then he may be in touch with 1%, 2%, he will affect. Then that 2 or 3% will affect 2 to 3. So then the chain reaction will go on. So we have to stop the chain. And the only way is to quarantine yourself. So even if you are suffering, even if you are the case, if you self quarantine yourself at home, then you are not going to spread that. And you have to only visit hospital if there is significant symptom which you feel which is disproportionate to what happened with you throughout your lifetime, right?
Absolutely. So you are saying that stay at home, that is the best bet at this point in time, and if you think that some symptoms are disproportionate to what you've seen in your life history, only then go in for a hospital visit and see a doctor. Well, I'll remind the viewers that these are the 3 phone lines on which you can call us. You can ask questions on novel coronavirus. We have 2 medical experts here in the studio to answer your questions. They are 01123097663, 011 is the code 233866682 and 01123097620. And there is a caller with us. Ravindra is there from Maharashtra. Yes, please go ahead, ask your question. Ravindra ji, आपको मेरी आवाज आ रही है?
Yes, ma'am, I can hear you. I just want to ask you, doctor. Yes, ma'am, I can hear you. आ रही आवाज?
Go ahead.
आवाज आ रही है मैडम? ना था ये what are the recovery? How can one person recover from this disease if he feels that he got fever, he got cough, and he got sneezing? If someone psychologically feels himself that he is being affected, what precautions should he take? Avoid to avoid something. मतलब सार्वजनिक जगहों पे.
Right, Mr. Ravindra. As far as I could understand, you are asking a question on how does one recover really if one exhibits these symptoms. I'll take this question to you, Dr. Deshdeepak.
So see, as we've been talking, most of the people will recover by themselves because we have our own immunity. That is how we become all right when we get any other flu or any other common cold or such disease. So most of the people, as we are seeing, 4 out of 5 people will become all right by themselves. And how do we say that okay, such person, like you must be listening, that okay, so many people have recovered. So how do we know that these people have recovered? So what we do is that once they start becoming all right, we again test them. So we take their samples and see whether the virus is still there or not there. And when we have found 2 such samples consecutively which do not have the virus, then we say that this person is now free of the disease.
Okay, fair enough. There's another caller. Ashok Ahuja is calling from Delhi. Please go ahead.
Okay.
My question is to Dr. Prasun Chatterjee. He is a geriatric expert, and his NGO is doing amazing work, old age India. I just want to know, I'm 64 years old. What are the general outlines for me to stay at home? This is my request to Dr. Prasun Chatterjee.
Dr. Chatterjee, we've been advising the elderly to stay at home, to quarantine themselves there, to stay in isolation, in other words. So what are the precautions, do's and don'ts that they should follow over 14 days? And why 14 days?
Yeah, 14 days we have already mentioned, because almost as per the previous study, 97 to 98% cases, it has shown that between the contact from the cases and the development of symptom is maximum 14 days. It ranges between 2 to 14 days. That is called incubation period. So anybody who has, even if has a contact, if we keep them in self quarantine at home for 14 days, that we can make sure that that person is no more a carrier. Number one. Number two, he will not spread in the community. That is our usual protocol in public health for any pandemic basically. So what he should do is he should take care of his hygiene, which we are repeatedly training. And as he is a senior citizen, I'll recommend him, Mr. Ashok Ahuja ji, so to keep within a single room if possible, and use your own. You should try to use washroom also, separate washroom, towel, everything should be separate. And remember one thing: don't touch the things which is without cleaning that properly, especially the metallic things, because the virus can persist even up to 9 days in any metallic things. Or and if especially if someone in your family has any history of trouble, then you must quarantine yourself and that cases. And anybody who is coughing and sneezing, they should use a 3-layer surgical mask, and try to keep distance of 1 meter, which we are repeatedly discussing. Use definitely 60% alcohol based hand sanitizer repeatedly as much as possible, and wash your hand properly, both front side, back side, clean your in between and nail. The cleaning should be proper, and don't touch unnecessarily only because of habit. We always touch in our nose, because ultimately the virus has to enter through a mucus. So eyes is there, nose is there, and mouth. These are the 3 common areas through which ultimately the virus will be in. So try to prevent yourself from getting the infection, and also prevent others to get infection from you, if at all you are the sufferer. And do yoga, do socialization from the house through digital technology.
Absolutely. So don't touch your mouth, nose and eyes unnecessarily. Just be very aware of how you can contract novel coronavirus, and thus follow the preventive measures as are being outlined. Rakesh, another caller is joining from Gurgaon. Please go ahead, ask your question.
मैं राकेश चांदा गुड़गांव से बोल रहा हूँ। मेरा प्रश्न है कि कोरोना वायरस कितने दिनों में सेटल हो जाएगा? वर्ल्ड की दूसरी कंट्रीज में कितने दिनों में सेटल हो गया? कितने दिन हमें प्रिकॉशन और लेनी चाहिए?
Dr. Deep.
Rakesh ji, I don't think anybody would be able to give you an answer to that question, that when would this pandemic end. But I can say one thing, that we are seeing that China is not having new cases, or not having a large number of new cases now. So which, if you see, if it started in the beginning of December, and this is if we are in mid of March, so you can see that in around 3 months time they have been able to control it. So if all the countries are able to take right measures, then soon we may find that this coronavirus is no more there.
And if I may ask a supplementary, yes, please go ahead.
I have one more point here. It depends on us, because it is a human to human transfer. There is absolutely this myth, there is no animal to human transfer in this country. So it's absolutely human to human now. So it is up to us. If we can quarantine, if we don't spread, ultimately the virus will has to fade away.
And Dr. Deep, on an individual level, what's the kind of time that people are taking to recover after being diagnosed with novel coronavirus? Is there any aggregate time?
Yeah, so absolutely. See, so most of the people are just taking the like whatever we take in normal flu, 4 or 5 days they are becoming all right, but those people who become sick, they take a longer time. And it has been seen in all the countries in like China and Italy and US, where there are more cases. They are seeing that the sicker you become, the longer you are going to take. The virus is going to replicate for a longer time. It is going to make you sicker for a longer time.
And are there cases of relapses as well, Dr. Chatterjee?
Relapse will only happen if you have second contact.
Okay.
And that is also will be milder from, because already our immune system has developed antibody against that virus. So that is that is the reason, that is the process also to development of vaccine. So there will be, once the immunity is developed, there are even if I have one more contact, it will be in milder form.
Okay, and one needs to follow 14 days home quarantine
Of
post
course,
discharge as well.
that is the best option, which
Okay.
Honorable Prime Minister also has mentioned.
Okay.
So, and I think that also underlines that why people are more scared of COVID-19 compared to, you know, the other flu diseases, because for this we do not have any immunity per se. Nobody has the immunity. Now when people are getting infected, they are developing partial immunity to this.
Okay. Another caller has joined us. Utsav is joining us from Jharkhand. Yes, Utsav, go ahead, ask your question.
Hello. हेलो
जी पूछिए सवाल, और अपना टेलीविजन का जो वॉल्यूम है वो कम कर दीजिए.
जी जी ओके. एक्चुअली मैं पूछना चाह रहा हूँ कि कम करो. ये कोविड-19 जो, मतलब अभी मैं यहाँ से एक रिमोट एरिया में रहता हूँ, यहाँ पे तो कुछ चेकिंग वगैरह कुछ ऐसा पॉइंट है नहीं, तो हल्की हल्की सिम्टम्स आती है तो फिर कंफ्यूजन होती है क्या है नहीं है. तो ये सब को ओवरकम करने के लिए कुछ खुद से जो हम लोग प्रिवेंशन ले सके, कुछ बेसिक पॉइंट्स क्या क्या हम लोग फॉलो कर सकते हैं, आप सजेस्ट कर.
Yeah, if you could quickly tell the
देखिए,
precautions that need to
आप
be taken.
रिमोट एरिया में रहते हैं तो द चांसेस ऑफ यू गेटिंग दिस आर remote. You know, the chances that you will get exposed, because ultimately you have to come in contact with somebody who's having the disease. Number two, the basic things that we have been repeating, you know, cough etiquettes, that means coughing in your elbow or using a tissue while coughing and discarding it in a closed bin, washing your hands properly for at least 40 seconds with soap and water, or with a sanitizer, at least having 60% alcohol for minimum of 20 seconds. You know, maintaining a distance of 1 meter. These are the things that you have to use. These are the basic, and in fact it is not for only COVID-19. These would help you in keeping away all the diseases which transmit through, which have a respiratory mode of transmission.
And don't presume that you are diseased, and don't take help from the over the counter medication, because there are a lot of story people are taking antibiotic, antiviral through over the counter. Please avoid that. Get a consultation by a doctor even if you suspect, but very, very unlikely you are suffering from that.
Okay, so hand hygiene, respiratory hygiene, as well as ensuring social distancing, and visiting a doctor if you think you have the symptoms, not going in for over the counter drugs are some of the precautions or preventive measures that should be taken. Another caller has joined us. Manish has joined us from Patna. Manish जी पूछिए सवाल.
जी मुझे यही जानना था कि ये जो व्हाट्सएप पे जो आ रहे हैं, कि फेसबुक पे आ रहे हैं कि हम लोग के तुलसी पत्ते से का सेवन करें, उसका काढ़ा पिए तो उसका इम्यूनिटी बढ़ेगी, मतलब कोरोना वायरस से अगर हुई नहीं है तो मतलब कभी होगी भी नहीं, मतलब अगर पकड़ी नहीं है तो पकड़ेगी भी नहीं. कुछ लोग ये बोल रहे हैं कि चिकन में जो है कोरोना वायरस पाया गया है और मटन में कोरोना वायरस पाया गया है, तो इसको अवॉइड कीजिए, खाइए ही मत, छोड़ दीजिए खाना. ये बात सच है या मतलब इसके पीछे क्या बताइए.
देश दीपक
जी देखिए, जैसा कि अभी अभी डॉक्टर प्रसून ने भी बोला था कि माना ये एक जोनोटिक डिजीज है, ये शुरू हुई एनिमल से, लेकिन अभी ये सिर्फ ह्यूमन टू ह्यूमन ट्रांसमिशन है, ये एनिमल से नहीं हो सकती. फिर भी हम सलाह देते हैं कि आप पूरी तरह पका हुआ जो भी आप खाना खाएं वो पूरी तरह पका हुआ खाएं, जो भी तो फिर इससे कोई आपको डरने की बिल्कुल भी ज़रूरत नहीं है. अगर आप जो भी मीट या जो भी आप कंज्यूम कर रहे हैं, इफ़ दैट इज़ फुली कुक्ड.
एंड नो मतलब जो भी आप कर रहे हो तुलसी का पत्ता के रस, दैट कैन नॉट प्रिवेंट फ्रॉम इन्फेक्शन, दैट मे इंक्रीज द इम्यूनिटी, बट ऐसा कोई एविडेंस नहीं है कि वो लेने से हो ही नहीं सकता, क्योंकि आपको अगर एक्सपोजर है तो देयर इज हाई चांस दैट यू आर सफरिंग, बिकॉज इज ड्रॉपलेट से जाता है इन्फेक्शन. सो खांसी से दूर रहना है, जो भी खांस रहा है उनसे दूर रहिए, वही एक कॉन्टैक्ट का तरीका है.
So food does not spread a novel coronavirus per se, and it is being transmitted through droplets. But there's another caller now. Arindam is calling us from Nevada. Arindam ji, ask your question, please. Are you there with us? Okay, we'll try and. Okay, fair enough. So that's about the kind of queries that we were asked by callers. Now, towards the end, your final comments on what really should be done going forward. 22nd of March, Dr. Chatterjee, is the Janta curfew day. So, do we need to build up on this going forward?
Definitely, we should follow this, and this is a testing period, as doctors have also mentioned. It may continue also, and it's better to continue as much as possible. If there is an emergency, you go out with proper protection. If it is not an emergency, please don't go out. Work from home, maintain health and cough hygiene, as we have already mentioned. We only can prevent this, and only way is to prevent this, because once this happen, the chain reaction can continue. So please prevent this. It is fully in our hand, and follow the Janta curfew, and also stop your work from home as much as possible.
Dr. Deepak, what
So,
would you say? Also, there's an
yeah.
over-reliance on masks that we see.
No,
Should that happen?
Absolutely. So these are the testing times when our courage and strength of character would be tested. So, and we have to understand that this is a short lasting disease. It would not last forever. So if we are able to take precautions for next 4 weeks, it is going to make a huge lot of difference. Masks should only be worn by people who have cough or sneezing, or who have symptoms. Masks should not be worn by people who are absolutely all right, because then it leads to improper usage of masks, and then those people who genuinely need masks will not get them if it is being used improperly.
Well then, thank you Dr. Chatterjee and Dr. Deepak for answering queries of our callers and viewers. And that's it then in this special broadcast. This is a show that comes to you on DD India at 7:30 p.m. every evening. You can call us, ask your questions. Experts here on our panel will be answering all your questions, dispelling myths, bringing out the facts to you. That's it then. Thanks for watching.